Let's admit it. We've been arguing about it for years, but today we might finally have confirmation. COVID-19 didn't just happen, it was created. But for what? Buckle up and welcome to the Revelations Rooms. This story dives into the heart of one of the biggest conspiracies of our time. The big questions we're gonna cover. If the virus was engineered or leaked, who's responsible? Did pharmaceutical companies exploit the crisis for profit? And most chillingly, could this happen again?
China has identified the cause of the mysterious new virus.
Coronavirus.
The year is 2019. An unknown virus emerges in Wuhan, China. The world shuts down, lives are upended, and economies crumble. But in the shadows of global chaos, whispers of conspiracy theories grow stronger. Here's where things get interesting. Just a stone's throw away from the Huanan seafood market, the alleged ground zero of COVID-19 is the Wuhan Institute of Virology, a facility known for researching coronaviruses in bats. Convenient, suspicious. A new 525-page report from a US House committee suggests the Wuhan Institute of Virology, China's largest SARS research lab, is the most likely source. The report points out unique and artificial features of the virus. US intelligence also revealed that Wuhan Virology researchers were sick with COVID-like symptoms in late 2019 months before the outbreak was officially reported. But what if, in their experiment, they created alleged bioweapons and accidentally spread them? Or was it an accident at all? Here's the deal. The first cases of COVID-19 emerged suspiciously close to this lab. Scientists argued it could have jumped from bats to humans via an intermediate host, like a pangolin. But, and here's the kicker, no bats or pangolins were even sold at the market.
And a month later, the Institute went into a communications blackout. There was no cell phone or signals activity on the compound for about 2 weeks. How significant would a blackout period at the Wuhan Institute of Virology, as has been reported, how significant would that be?
And again, it would be another circumstance that would be difficult to explain other than there was a problem that the Chinese Communist Party was aware of and was trying to deal with before it became an outbreak that was public and then ultimately a pandemic that affected every single person on the planet.
What if it did happen? Picture this. A researcher mishandles a sample. A virus escapes. At first it seems minor. Then weeks later, the first cluster of pneumonia-like cases emerges. By the time anyone connects the dots, it's too late. What's more, biosafety at the Wuhan lab has been called into question. Reports claim some experiments were conducted under BSL-2 conditions, a level of safety comparable to your dentist's office. If you were creating potentially pandemic-level pathogens, wouldn't you want stricter protocols? Enter the lab leak theory. Originally dismissed as a wild conspiracy, it gained traction as whistleblowers and independent investigators dug deeper. They pointed to genetic anomalies. A recent report states that the coronavirus has biological characteristics that do not exist in nature. And then there's the money trail. Documents revealed that US-based organizations funded research at the Wuhan Institute. Did they know what they were backing? Now let's talk about the elephant, or dragon, in the room. Geopolitics. The US accused China of covering up a potential lab leak. China fired back, claiming the virus could have originated at a US lab like Fort Detrick. But why would anyone cover this up? Fear of accountability. Admitting a lab leak could mean reparations, sanctions, and a PR nightmare. Economic impact. Imagine the lawsuits. The global economy could spiral further if blame were definitively assigned. Geopolitical advantage. Both nations use the uncertainty to deflect attention from their own mishandling of the pandemic. COVID-19 didn't just change our lives, it reshaped the world. Here is top 5 drastic changes. 7,010,681 people have died so far from the coronavirus COVID-19 outbreak as of April 13th, 2024. There are currently 704,753,000 890 confirmed cases globally, total cases. This figure includes deaths and recovered or discharged patients. Disruption of supply chains. The pandemic severely disrupted global supply chains, economic shifts. While small businesses crumbled, pharmaceutical giants like Pfizer and Moderna saw record profits. Was the rush to develop vaccines driven by altruism or greed? Public trust eroded. Conflicting narratives and suppressed investigations left people questioning governments and scientists. Racial tensions amplified. Anti-China and xenophobic rhetoric spurred racism and violence, particularly against Asian communities worldwide. Global economic shifts, rise of e-commerce. Lockdowns accelerated the adoption of digital platforms, creating a boom for tech giants like Amazon, Shopify, and Zoom. Workforce transformation. The remote work culture became mainstream, reshaping office dynamics. What if the pandemic wasn't just a crisis, but a carefully orchestrated plan? Imagine a virus designed to target the vulnerable and elderly, paired with strict isolation rules that chipped away at mental health and human connection. Quarantine measures, travel bans, and pay-to-enter policies made global movement a luxury, quietly dividing societies between the wealthy and the struggling. All while whispers grew that the aim wasn't just health safety, but a subtle reduction in population, a reset of global dynamics under the guise of public health. Some believe the pandemic was staged to usher in a new world order, a one-world currency, tighter monitoring, and centralized control by elites. Sound far-fetched? Maybe. But the pandemic did accelerate trends like the operation of logistics, digital payments, and remote work, reshaping how we live and interact. There is no evidence in the report to suggest that the US was intentionally involved in spreading the virus. However, indirect involvement through funding research at WIV raises questions about accountability and the risks associated with gain-of-function studies. These findings highlight the need for greater transparency and stricter global research protocols to prevent future outbreaks. COVID-19 was more than a health crisis. It was a wake-up call. Whether it came from a bat, a lab, or somewhere in between, the damage and influence it left are undeniable. The question is, what are we willing to do to ensure history doesn't repeat itself? What do you think? Was COVID-19 a tragic accident, or is there more to the story? Let us know in the comments below. Don't forget to like, share, and subscribe for more deep dives into the conspiracies shaping our world.